Hi everybody, welcome to our latest installment of Healthcare Fact Chat. My name is Claudia Lennhoff and I'm the Executive Director of Champaign County Healthcare Consumers.
And I'm Adani Sanchez, Client Services Coordinator of Healthcare Consumers.
And today we're going to have a sort of freewheeling discussion about there's a lot of uncertainty for the Affordable Care Act right now and for insurers and pricing their plans. And there's also a lot of pretty active sabotage that is happening, unfortunately, under the Trump administration that you're going to be hearing about. And then there are also some pretty shady moves afoot to try to see about trying to repeal the Affordable Care Act again. So we're just going to have a sort of freewheeling conversation about that. Why don't we start first with so one of the things that's coming up is the Affordable Care Act, open enrollment. Do you want to explain what that is and the time frame and how things are changing for this upcoming one?
Yeah, open enrollment period is the time where anyone, regardless of, whether or not they just lost insurance, whether or not they got married, anyone can go onto the marketplace and sign up for a plan and get a plan during open enrollment. Usually it's closed because, usually they don't just let people on if they're sick, like that would create problems with the insurance market. So they kind of just have a period every year where anyone can kind of jump onto a health insurance marketplace plan.
So these are for individual plans, so people who don't have health insurance through their employer or can't afford that insurance can get an individual plan. And just like many large employers will have an open enrollment period. So now there's a national open enrollment period and you jump onto healthcare.gov. shop for insurance plans, and then that's also where you can see if you qualify for subsidies to make them more affordable.
Exactly.
And so this will be open enrollment 5.
Correct.
Okay, and then normally, previous to this open enrollment, how long did the open enrollment period last?
It was multiple months. So it would, last year it went November 1st through January 31st. So about 3 full months of being able to go jump on. I know that a lot of people get on towards the end, and now that has been dramatically cut short. So this year going forward, open enrollment is going to be November 1st through December 15th.
So 45 days.
Correct.
During sort of the holiday season.
Right.
So 45 days during the holiday season, and it's really important. We're trying to get people to start thinking about this now because people frequently do need help with that, and we're here to help. Adani's here, and Chris, and we're here to help people with that. But what people need to know is that it's going to be a much shorter time frame this year, just because of the decisions that HHS Secretary Tom Price has made. And this is these are the kinds of decisions that we think the administration is using to sort of sabotage the Affordable Care Act to try to reduce the enrollment, reduce people's opportunities to access health insurance, and it's a pretty unusual move. So we want people to be aware of that. So to me, that seems like an active form of sabotage because we have found that people do need a longer period of time to go through the enrollment. That puts a strain on the organizations that are assisting people. And so that's another form of sabotage that's happening now that people might be hearing about in the news, right?
So the Health and Human Services, which is tasked on fulfilling open enrollment, getting that out, advertising, encouraging other organizations, and funding other organizations to help enroll people. That's their responsibility. They're actively cutting ties with organizations that maybe do. I think the most recent one I heard of was cutting ties with the Latino organization that helped. That was focusing on immigrants and Hispanic people and getting them enrolled. And so they haven't even heard from Health and Human Services. So they're just kind of letting it fizzle out. They're cutting budgets, they're cutting funding for advertising about open enrollment. Again, letting these partnerships kind of slide and not really picking them up. And then they're actively sending out information that is really kind of maligning the Affordable Care Act. So it's not just, we're kind of just letting these things go and kind of doing these inexplicit things. Like, they're very actively saying this is really a horrible thing, and almost like pushing people to not actually even enroll in this bad thing. And so it's a really problematic, and I'm really concerned about what that's going to mean for people who need insurance and are looking for a place to get insurance.
So just going back to what you were saying about the HHS cutting ties, so people may have heard about this, where some of the organizations that were funded to do the navigator work, which means enrollment counselor work, like what we do, organizations that were funded by the federal government are no longer going to be getting that funding. And so that is an active sabotage that is actively taking help away from people in the form of cutting funds to the organizations that helped enroll millions of people. One thing I should say is that Champaign County Healthcare Consumers has been doing enrollments since day one. And we are very fortunate, because of community support, that we can continue to do that work. We never received the federal funds because we're too small of an organization, so we were never able to receive that kind of funding. But you can still count on us to be here to do the enrollment work. But a lot of the organizations around the country that got funded for that work are not going to be able to do it. And so people are going to be kind of left out in the cold trying to figure out how to do it on their own. So that's definitely one type of sabotage, and that's been in the news a lot since the beginning of this week. And then the other thing that you were talking about is the messaging and the maligning of the program. And you're seeing this in tweets from HHS.
Yeah, official Health and Human Services tweets.
And you're seeing it also, I believe, on the website. They have information about counties where they have no insurers, they have zero insurers in the marketplace, which, to be fair, is definitely a problem for those counties, but that is not the majority of the nation.
And that is also something that Health and Human Services is partly responsible for trying to fix. Like, this is part of their responsibility, is to go out and talk to insurers and encourage them and tell them about the marketplace, tell them that this is important and this is necessary, and that's not something that they're doing. So again, by just kind of letting things go, by kind of not showing an interest, and then actively going against the marketplace and messaging against them, it's really problematic.
And so when there are counties where actually an insurer does come in, like I think Nevada has had a few counties where an insurer has agreed to come in, like even this week, I don't think that that's being celebrated on HHS. So just be aware that from official channels, the information is going to be very skewed about what's happening. And that, again, is to discourage people from getting coverage. Another thing is, going back to the very first executive order that Trump signed as president, it was basically that he was not going to enforce the individual mandate. And so that means that people aren't going to be healthy. Typically younger people are not going to be driven to go and purchase health insurance. So there's all this sort of like, sabotaging. Some of it is not very subtle at all. But then one of the big things that you will probably be hearing about or have already been hearing about is about the cost sharing reduction payments, which we talked about in our last video. So if you want an explainer on that, go back and watch that other video. But basically right now, insurance companies are very uncertain about what is going to be happening in terms of like their financial ability to meet the demands in the marketplace. And so how does that play out?
Well, the health insurance companies are really going to be left with no other option than to increase premiums to make up for the loss of these payments, of these cost sharing reductions that are coming in. So they don't know what to do, right? So when you've got this risk, you're going to plan for the worst risk, right? So they're going to be increasing premiums, which is then going to come down and affect consumers directly and increase their out-of-pocket costs, increase their premiums, and really end up making it worse off for the consumers.
And in fact, didn't the CBO say something about that just today?
Yes.
About, I think it was something like a 20% increase because of this uncertainty. And so people can know that that's directly a result of the uncertainty, being sort of cultivated
Yeah.
by the Trump administration.
And pushed and announced and encouraged. And again, things like cost sharing reductions are addressing the very things that the Trump administration, that many Republicans were talking about. Our own Representative Rodney Davis said premiums are too high, deductibles are too high, and this uncertainty about cost sharing reductions is making all of those things go up, and health insurers are not afraid to come out and say it now, which is, I think, is really important to be able to say, like, oh, already premiums were going up, there were already problems, right, that we recognize, and now they're being made worse and exacerbated by these stunts.
Well, what else do you have in this bag of terrible tricks for how to undermine the Affordable Care Act?
Again, I mean, right now we're even seeing already these bureaucratic changes having an effect on how people access the health insurance marketplace. For special enrollments, if something happened where you had a new dependent, you lost your health insurance involuntarily, you got married, that would be something that would qualify you to go to get an open enrollment period through the health insurance marketplace and be able to buy
special
health
enrollment.
insurance. Correct.
Outside of the regular open enrollment.
And now, before you can even get enrolled in that coverage, you do have to provide documentation. Documentation was always required.
Sure.
It was just kind of, if there was some sort of urgency, they would be able to, make sure that you could go ahead and get enrolled first and then be able to submit documentation later. So it's not a change in the actual requirements.
But it was like a presumptive eligibility that we'll go ahead and get you signed up, you'll go ahead and get your insurance started, and you will send along the documents shortly. And so you had a little bit of time to get the documents together and send them in, but you wouldn't have to have necessarily a gap or a delay in your insurance coverage.
Right. So this is really going to hurt people who maybe aren't in workplaces that give them in transparent workplaces where they don't give them documentation. Maybe you don't get your documentation. Maybe the state sends you a letter that says you're losing your health insurance, and they never sent, they say that they sent it to you, but you actually never got it, and so you question it, and so that's going to hurt people who now have to go and appeal and ask for this and have kind of nothing to show for it, but maybe really need, in a more urgent way, need their health insurance to start.
Well, I think part of what this shows is that how much of having a program like this is really dependent not just on the legislative process, but actually the administrative process. There's also a rulemaking process, but there is a lot of leeway that the various departments and agencies have in promulgating like procedures and rules and decisions and things like that. And so there's a lot of ways of strengthening a program or sabotaging the program, and unfortunately, we're seeing a lot of sabotage now. And one of the things, Adani and I were actually going to talk today, but we're not going to, but we were going to talk about some of the bipartisan legislative efforts to try to stabilize the Affordable Care Act and all that, and we will do that a little bit later. But we're in recess right now, and so there's not a lot of movement that way, but there is on this administrative level, and so that's why we wanted to talk about that today. But then the other thing is, there's some other funny stuff afoot that I just have to mention. We just talked about it and saw it today, but apparently Trump is really, really pushing the Senate to get the repeal done, and he wants Mitch McConnell to get to the 50 votes. And so he's thinking about appointing Democratic Senator Joe Manchin from West Virginia to the Department of Energy. Right now, the head of the Department of Energy is our fellow Texan, don't hold it against us, Rick Perry, and he may be getting moved over to someplace else, creating this opening, and then apparently the plan is to try to get Democratic Senator Joe Manchin from West Virginia into the Department of Energy. If that happens, then that creates an opening for the Senate seat in West Virginia. And as people may recall, West Virginia Governor Jim Justice just announced his conversion back to being a Republican. So the idea is that he had just switched to become a Republican again, and then he would have the authority to fill that Senate seat. And so the writing on the wall is that this would result in a Republican taking that seat as opposed to a Democrat. And so it's really important to keep an eye on this. I feel very nervous that we're not done with the Senate efforts to repeal the Affordable Care Act and also cut Medicaid. So it's really important to to stay tuned right now and to we just can't let down our guard.
No, they're still chugging along. They're still trying to figure out, especially with pressure from the administration. I think it's becoming a little bit more. They're going to try different ways. They're going to be a little bit more resourceful now, maybe.
We're in a horror movie right now, but we hope that ultimately the forces of good will prevail, and we're going to continue to work hard at it. Just before we sign off, just wanted to remind people again that open enrollment is November 1 through December 15th, 45 days. So pretty soon you're going to see us start letting people know that if they want to schedule appointments and things like that. I mean, we're still a little ways out from that, but just heads up and help spread the word, make sure everybody knows. And we'll be back next time with whatever else is
whatever new horrors have arisen.
Yeah, stay tuned.
Thank you.
Thanks, everybody.